Good morning, good afternoon, good evening. I'm so excited that you have joined. I'm so excited about the conversation we're about to have. I'm so excited to be able to celebrate my birthday with you and to do something together to continue acting with humanity in this moment that more than ever we need to be together, remembering that we're here for each other. So I'm super excited. For those of you who might not know me, I'm Pat Garcia-Gonzalez. I'm the CEO and co-founder of the Max Foundation. And I'm really honored that you are spending your time and you're prioritizing this webinar and help me celebrate my upcoming birthday. My birthday is going to be on July 28th, so just 11 days to my birthday, and it's wonderful to be able to do something more than just celebrating a birthday, to do something for others. I'm very privileged. I feel privileged today that we have Dr. Sucharita Tuladhar, a pediatric oncologist from Patan Hospital and a partner of ours at the Max Foundation. And also I'm going to be joined later by my colleague Sweta Agrawal, who's our program coordinator based in Kathmandu. But before I invite Dr. Sucharita to give us an overview of the situation with pediatric oncology in Nepal, I just wanted to share why I decided to dedicate my birthday to support her work. First of all, last October, I had the privilege of visiting Patan Hospital in Nepal. As you might know, the Max Foundation works in 83 countries. It's a huge scope of countries and regions where we work. So I haven't visited all the hospitals. We work with about 300 hospitals, and I had never been to Nepal, and I had never been to Patan Hospital, and I was really looking forward to being there. I feel that these visits are a very important part of my job. There is nothing that can change spending time in the hospital, talking with the healthcare professionals, and really witnessing the patient journey. We talk a lot about the patient journey, and sometimes when we're here, we miss the most important parts of what barriers might be on the patient journey, or how does the patient experience their care and their cancer journey. You know, many of us have been working on what we call LMICs for many years. And we think that we know what's going on. We've been around, we've lived it, and we know. But, being there reminded me that reality is always different. Often is very sobering. And so one thing I have learned is that it's impossible for us to develop solutions here from far away. And we really need to go meet, and not to teach, but to listen and to learn. And that's what I did in October. Patan Hospital, my experience was pretty impactful. It's a large hospital, very crowded on the days that I visited. The hallways were crowded, filled with patients standing, sitting, waiting, pushing through these crowds. It was not very easy to push through the crowd to get to where we wanted to get. It feels like life at Patan Hospital happens in overdrive. People move fast, they know where they're going, they're multitasking, but it was all like a very choreographed dance where everything knew what to do, what to expect. The place is managed so efficiently. Everyone takes so much pride in doing their part. They care for patients, they care for the medicines that we're providing. Physicians move from one thing to the other. I was very impressed how physicians adapt to each patient so quickly and seamlessly. And so it was a really great experience. I was extremely impressed with Patan Hospital and what they're doing, how much they're doing with very little resources that they have. And I was excited in the afternoon to meet Dr. Sucharita. I had never met her. She is the pediatric oncologist in the hospital. And I had heard for a couple of years of a program that was led by St. Jude and the WHO that was about to be launched in Nepal, a global fund for pediatric cancer aiming at providing access to all the medicines that children need to be treated for cancer. And that, for me, was such a dream. And I've been so excited about this because, from the time of our experience with Max, and I think every parent can understand, it is the worst possible nightmare that you can have. To hear that your child had cancer, I think, is the most scary thing that can happen. And just to know that for many of these cancers, pediatric cancers, there are really good treatments, and that the disparity in survival and care and of these children is so big that is unnecessary. I always think about the unnecessary suffering of these children, the unnecessary suffering of the parents. And so I was so excited when I heard that St. Jude and WHO were going to take this on and have the goal of providing all the treatments that children need in about, I think it's like 50 countries or something. And one of the first countries was Nepal. So I asked a lot of questions to Dr. Sucharita about, the actual initiative, and she explained the rollout of the initiative. I was, of course, very impressed. Everything seemed very comprehensive. It seemed very well thought through. I wouldn't have expected anything different. All the pieces seemed to be falling into place. And then, except for one, she mentioned, except for one. This initiative helps families of children that are diagnosed with cancer. What happens before, from the time the child is sick and having symptoms to the time that can start treatment? Many, as you know, many tests have to happen. And many of these tests cannot be done in the hospital. They are done in a private lab. And so parents have to pay out of pocket, and many of them don't have the funds. And these children might not be able to take advantage of this opportunity because of this. So right then and there, in that afternoon, in that moment that she said that, I knew this is something we can fix. And I decided immediately, I have been dedicating my birthday to our mission, to the mission of the Max Foundation, for about 8 or 9 years now. And I knew that this year I wanted to help Nepal. I wanted to support our programs in Nepal. And we are already providing treatments in Nepal. We're providing transportation funds for patients, some diagnostics. And I wanted to expand. I wanted my birthday to help us expand our services so that we can provide that support. So any family, they don't have to worry about that, with all the worries that they have when their child is being sick. That I want to ease that pain and worry of how am I now going to pay for all these tests that need to be done. So this is why we're here. And I've been excited already to launch my campaign. And, I know that we're all going to step up and help these children. So now I would like to invite Dr. Sucharita. She's here with us today, and she's going to share her perspective on pediatric cancer in Nepal. Take it away, Dr. Sucharita.
Thank you. Good morning, good evening, good afternoon, everyone. I am Dr. Sucharita Tuladhar. I'm a pediatric oncologist working in Nepal, and it's an honor for me to be here today representing children, children with cancer and their families who go through so much adversity but stand tall and face it all. Childhood cancer. Childhood cancer is not just a medical problem, it's a societal issue, it's a public health issue, and above all, a moral issue. I said moral issue. Let me tell you how. A child born in a high income country with cancer and a child born in low income country with the cancer, the chances of surviving of the disease depends upon where they are born. This is the moral issue. Geography should not decide the outcome of their disease. 80% of children with cancer will survive in high income countries. 4 out of 5 children will become teachers, scientists, and fulfill their dreams and live their life to the full potential. But for a child with the same disease born in a country like Nepal will have only about 20% chances of survival. It's not about the biology of the disease. Here, the geography becomes the biology. And let me tell you about what happens in Nepal. Childhood cancer in Nepal, we estimate that around 1,500 new children suffer from cancer every year in Nepal, but majority of them are diagnosed or are never diagnosed at all. Only around half of them reach the treatment centers, reach the tertiary care centers. The problem is not only about the diagnosis. There are limited centers and limited healthcare workers who are trained in pediatric oncology. For a population of around 30 million, just imagine there are only around 15 pediatric oncologists in the country. And even once they reach the uh, treatment center, the financial burden is catastrophic for the families. Not only the direct cost of the treatment, the indirect cost, the travel cost, loss of income is quite catastrophic for the children with cancer and their families in Nepal. This is an old picture showing the centers who are treating children with cancer, and the reality in among one of the premier institutes treating children with cancer, only around 40% will survive, and above all 35% abandonment due to financial burden and 25% mortality due to infection, drug toxicity, and relapse, in addition to the disease-related mortality. So why is this disparity? Is it only due to financial constraint? Yes, financial constraints is one of the major reasons. The direct cost of the treatment of the investigations, staying in the urban area, the rent, the transportation, all that, and also the late presentation. A child who has a cancer which is totally treatable if presented in early phase, presents in the terminal phase, and there is very little we can do to make the child better. And once they start treatment, lots of families stop treatment. Their children usually belong to families with multiple children, and leaving all that and staying in an urban center, especially the girl child, if it belongs to a family with several girl child in the family, there is a very high chances of treatment abandonment. We all know this is happening, but Nepal also suffers from lack of data. We do not have a population-based cancer registry throughout the country. We have decided we will do a hospital-based cancer registry, but we are still in a very early phases of hospital-based cancer registry. And above all, in addition to the treatment per se, the chemotherapy per se, there is lack of adequate supportive care. Children with cancer on treatment requires blood products, antibiotics, and several other things are required for a child to have a good outcome. So those are the things which causes disparity in the low. It is true for not only for country like Nepal, any low or middle income country has a similar story. And above all, we have to keep in mind that childhood cancer is not preventable. It is not like adult cancer where if you do not smoke, you do not suffer from cancer. There is no childhood cancer is not preventable. The only way to get a proper good outcome is by diagnosing early and giving proper treatment to the child. So there are issues, but is country committed to change? Definitely. The government and the physicians together are committed to bring about to positive change in the country. There has been considerable progress in the country. Nepal is a GICC Global Initiative for Childhood Cancer focused country, and the WHO, St. Jude's, and the global community is determined to improve the outcome of children, irrespective of their geography, to at least achieve at least 60% survival in all over the world, and to reduce suffering for all children with cancer by 2030. In addition to this, Nepal is fortunate to receive the global platform chemotherapy medicines from global platform for access to childhood cancer medicine, which aims to provide an uninterrupted supply of quality and assured cancer medicines, not only the continuous supply, but a quality assured medications. And many children with cancer have to travel from far off countries, remote villages with very little transportation services, have to come to the city. But we are also working on that to decentralize the treatment uh, by facilitating the shared care centers in all the provinces where the low intensity chemotherapy can be given, or the supportive care can be given in the shared care centers. So we are training the physicians over there to provide treatment to children with cancer who require less intensive chemotherapy or who are on maintenance phase and require supportive care can be given within very near to their own homes. We are also working towards training the physicians and healthcare workers who are the primary healthcare workers who are working in different parts of the country, who interact with children for the first time, to think about malignancy as one of the differential diagnosis and send them to the proper treatment centers in timely manner, so that as childhood cancer is not preventable, it can be diagnosed early and proper treatment is possible. In addition to that, not only in the in training the healthcare workers who come in contact with the children, but we are also going to anywhere and everywhere to create public awareness about children with cancer. That children do suffer cancer. Not every symptom is cancer, but children do suffer cancer. And if there is any child within their neighborhood, or they know somebody of such children, they should provide they should advise them to go to the nearest healthcare center to get timely care. We went to churches, schools to create awareness regarding childhood cancer in the community. In improving the outcome of in an initiative to improve the outcome of children with cancer, we have partnered with international organizations like Max Foundation, who has played a vital role in providing us financial support, medications, and other support for children with cancer. Other organizations like Leonardo Edwards Rester Foundation, who provides accommodation and meals and transportation for children during the intensive phase of the treatment, where they have to stay in the urban area near in the capital city. They have been vital in providing support to children with cancer. But is it enough? Still the gap remains. Diagnosis is still out of reach. Every patient who gets the treatment support is the treatment support, all the government funds, everything starts, it kicks in once the diagnosis is established. But the bulk of the money or the investment or the out-of-pocket expenditure is there when a child is suspected of cancer, and we are doing investigations to confirm the diagnosis. We are doing staging investigations. That is when the bulk of the money is there. And just imagine a mother, a father with a child who, just imagine the status of a parent who has been told that your child might be suffering from cancer. They are emotionally down, they can't think of anything, they belong to very remote areas, they come to the city, they don't know anything, and they have just been told your child might be suffering from cancer, and you have to do such investigations. They have hardly heard about those investigations, and they have to they have to invest a lot of money. So, and government funds kick in once all the medications, everything starts once the diagnosis is established. That's one of the reasons why many children go undiagnosed, or precious time is lost to gather funds for diagnostic tests. Without diagnosis, there is no treatment. Without treatment, there is no chance for cure. This is a burning example of what happens before a child is diagnosed. This lady who was traveling around the country, even to the neighboring country, just to have her child diagnosed with what the child was suffering from. She spent almost 1 year and almost 8,500 USD before she came to Patan Hospital and was diagnosed with cancer. This all happened even before her treatments was initiated. She had spent her life savings just in trying to get a diagnosis. This is the story, real story of what is happening in the country. So, but together we can change the story everywhere. Every child everywhere deserves a chance to survive and thrive, irrespective of the place they are born, irrespective of the geography. So your commitment can close the gap, and let's turn commitment into action and action into hope. Thank you.
Thank you so much, Dr. Sucharita, for that sobering, and yet encouraging presentation. You know, I do think a lot about pediatric cancer, and I can't understand how this hasn't been a priority for all of us in the world, because all of us are parents, and all of us know that how scary it would be, or it is, when your child is diagnosed with cancer. I have concluded that it's so scary that people don't want to think about it. It's like so scary that we try to take it out of our mind unless it happens to us. And you know, I'm grateful to you. I'm so grateful to you and all the other pediatric oncologists that are making a difference. So right now I'm happy to invite another, let's say, panelist to this discussion, my colleague Sweta Agrawal, who is our program coordinator in Kathmandu, and she's going to join Dr. Sucharita and myself. And I have some questions for both of them. And welcome, Sweta. I'll start with Dr. Sucharita. And, you know, as we were saying, it's such a difficult field, pediatric oncologist. And I'm aware that you are the first pediatric oncologist in Patan Hospital. So I wonder if you don't mind sharing a little bit about how and why and what was it like to be the first pediatric oncologist in the hospital?
Thank you for your question. Uh, when I was doing my pediatrics and in Kanti Children's Hospital, one of the children's hospital who treats pediatric oncology patients. So over there, I used to see lots of patients, but after a few months, if I go and ask where is the patient, at times those children wouldn't be there. And after I concluded my residency, when I was working in Patan Hospital, I came across lots of children with cancer, but we did not have a place to send them. It was very hard to refer them. That's when I decided this is where I can make an impact, and I went to India to get my training. So in pediatric oncology, after 2.5 years of training in pediatric oncology, I came back very starry-eyed, rosy-eyed. Yeah, I'm going to make a change. This is me, very enthusiastic. And very soon, as soon as I joined the Patan Hospital and started the services, I realized that treating children with cancer is much more than just giving them medication. The clinical part is just around not even 50%, around 30% of it. I was trying to train the nurses, I was trying to include the pharmacist, convince the administration, yes, this is very where you can invest. So trying to find a place to put the beds. So took a long time, and it took lots of hard work to establish the services, to say for everyone to take notice, yes, children with cancer do survive, and they do survive in our own country. The services can, the standard of care, which we say the standard of care can be given in our own setup. The international protocols can be used in our own setup. We just have to work for it. We just have to partner with the right organizations. So that was how it all started, and we are still working on it.
Thank you so much. Thank goodness for you. And, I was thinking they don't teach you that in medical school, right? They don't teach you that it's really not about the medicine. It's all these other circumstances that you really have to see in real life and care about all these other parts. So we're very grateful for your energy and for your drive. Okay, now I'll turn to my colleague Sweta. As I mentioned, Sweta is our program coordinator. She's based in Kathmandu. And, I often said in our organization, the program coordinators are the most important people in the organization because, she is responsible for all these programs to actually work in the country. And same as Dr. Sucharita, we're so excited to send medicine to Patan Hospital and other hospitals in Nepal, but nothing will work unless we have people like Sweta that sort of go around fixing all the logistics and the problems. Sweta has been with our organization for more than 8 years now. So no one better than her to speak about the programs in the country. So Sweta, maybe you can spend a few minutes explaining your role and our work in Nepal.
Thank you so much, Pat. Hello, everybody. Good morning, good evening, good afternoon, as per the time zones. So my name is Sweta Agrawal, and I am based in Kathmandu. As Pat mentioned, I am with the Max Foundation for more than 8 years now. I work very closely with the physicians of Patan Hospital because I am based in Kathmandu, and we manage other two hospitals also in Nepal. One is the BP Koirala Memorial Cancer Hospital in Chitwan, and another one is Sushil Koirala Prakhar Cancer Hospital in Nepalganj. I make frequent visits to Patan Hospital, and often we visit the other two institutions also. So talking about the job and the program, I see my job as solving the problem. That can be any type of problems, just to make sure that the program is running smoothly as per the guidelines. For example, we do everything to make this happen. We talk to the patients, we we counsel them for compliance, and we guide them to take their medication on time, to collect them on time. And apart from this, this is a very vast role. So when we hear about any undesirable, say, situation from a patient or the physician or caregiver, we often record it in our system, which we call as AEs, adverse events. So when he's on the treatment, whenever we learn something, we have to log it. So and I really love talking to patients. Each day we receive calls, as we have we have phone calls, we have so we receive calls from the patients, and they have some of the other issues, problems, or even even if they don't have any problems, they would just love to connect to us and say, okay, I'm here for my follow up and all. So and we guide them about their visits, about their tests to be done. And when they face issues to travel, they call us, like, if there is some, say, natural disaster like the landslides or the heavy rainfall which could not make them visit the institution on time, they simply call us and ask for our guidance. So we guide them accordingly. And there are also times when the physician has changed their dosages and they were, like, very confused about why was it done or what to do now. So we also guide them to stick to what the physician has advised and follow up accordingly. So I am also in touch with the physicians, all the physicians who are in our program, and few of them who are not also in our program, as they recommend the patients to us, and through WhatsApp, I am in contact with our physicians with whom we work very closely. So they call me when they want to know about any, like, the slots of the medicines, or say the approvals. If they want to approve a patient quickly, they would just send me the documents on WhatsApp and say, can you please do the verification so that the patient can collect the supply today itself on time. And then yeah, and I also am in touch with the physicians for the documents of the patients or the prescriptions for as per the label indications, because sometimes they just write the prescriptions and it is not as per the label indication. So Charita ma'am is smiling because I've done this with her also. So we also manage the diagnostic programs according to the guidelines in the hospitals. And a lot of time I spend logging in our system, like the logging the conversation or the in the system where we work. So I we update the status of the patient, the all the follow-ups we do for the shipments which are on the way, or maybe when we start the ordering part, so that time also. And then we record the date and the quantity of the supply when the patient has collected it, which helps us to do the forecasting of the drugs and avoid any type of stockouts. So I also receive a lot of calls from patients and caregivers inquiring about the treatment support. These patients are not those who are in our system. So these are those who are not in our system. So we also guide them accordingly. So last year, I was really excited. I mean, I can go on and on, sorry. I was really excited, when last year we had launched a program in Patan Hospital, which we call as Last Mile. And that actually means the transportation support to the patients. So we started that with the breast cancer patients initially. And it has been wonderful to see the better, treatment compliance of the patients. And they are now able to keep up to their appointments. So, and we are now working on expanding the programs with more of our support. So yeah, these are few of the things which we do in Nepal. So I think this has given a more of overview, Pat. Over to you.
Thank you,
Thank you.
Sweta. Thank you. You are a one-woman show, I think, in Nepal. And you haven't mentioned, I don't want to put you on the spot, but what's around more or less the number of active cases that we have in Nepal today?
Oh, it is somewhere around 2,400 active cases currently.
2,400.
Yes.
So when you say all this about taking calls and all that, it's 2,400 patients that you take care of. So thank you so much. I mean, we couldn't do this without you. Dr.
Thank you, Pat.
Sucharita, a question for you. I know the government, is very supportive, and the hospital provides so much support to patients. I don't know if it's possible to tell us a little bit why these diagnostic tests are not covered for the families, if it's possible to tell us. I don't know if you know why, but
I think the government, the government is very much committed to improving the outcome for our children with cancer. So it's trying its best to work in every possible way. But there, when like providing free treatment or providing treatment for cancer, everyone thinks that it is once the child is diagnosed with cancer. So
Right.
many of them do not realize there's so much of it goes before the diagnosis is established. There are very important tests which help us to diagnose cancer, like immunohistochemistry, flow cytometry, molecular testing. These are all done before the diagnosis is established or at the time when we are suspecting of cancer. And I think because the government has not understood till date what goes into the diagnosis of cancer, that's why there is no commitment from the government till date. If the government understands the concept of universal health coverage, even before the child is diagnosed with cancer, we need to support the children with cancer. I think there will be some support from the government, but that is yet to happen right now.
Thank you so much. I understand. Thank you so much. And so today, I mean, you've come such a long ways. You know, you have the WHO St. Jude program, you have some of the medicines. Now we're going to help with to fix this problem that you just talked about and make sure these families don't have this burden. Are there other barriers still that you're concerned about that is going to get in the way to have the best outcome for the children?
Yes, there are definitely lots of things which we still need to do. Like it's not only about the financial constraints. Financial constraint is a major aspect, but there are mental health issues like psychosocial support providing to the children with cancer, to the families who come, who are treating children with cancer, the after chemotherapy clinics. Like we are yet to do any after chemotherapy, like long-term side effects of chemotherapy, how it will happen to children with cancer when they are cured of cancer, but still the effects of chemotherapy is there. Who will take care of these children once they grow up? So that is yet to occur. And one of the, I think, biggest weaknesses Nepal has is the lack of the proper data. We do not have the proper population-based cancer registry. And we are working towards hospital-based cancer registry, but we do not have the accurate data, and data saves lives. And all the programs will be successful once if only we have a good data. So those are our major weaknesses where we really need to work on.
All right, we have our marching orders to, we're not done with this one birthday. I'm gonna have to hurry up and
I'll make
have
sure you do.
very soon. So Sweta, I think you told us a little bit of how do we in Nepal try to help overcome some of these barriers with the issues related to social determinants of health. So maybe you can just share a little bit more about the programs.
Yes. So recently what we thought was we had to help patients because there are some patients who cannot afford to even travel to get the access to their medicines. So, we had this support which Pat had provided, and we started with breast cancer patients being females. At this side of the world, there are different issues with female patients. So we started with female patients and we started giving them support for their transportation to and fro, for the visit when they come for their tests and follow-ups. So that has really helped us, and we have seen that none of our patients, breast cancer patient, has missed any say follow-up because of the travel issue. Because when we do the verification, we inform them about the grant they will be getting for their travel allowance, and our physician who is treating our breast cancer patients, he's also supporting us in this. And with the help of Patan Hospital and this physician, we have successfully till now we have seen success in this program.
That's wonderful. That's wonderful. And thank you for, I know that it took a lot of time and effort to put this in place, and that is so great. I just feel that there are some problems we cannot solve, but there are some other problems we can. And I always think if we can, we just have to. And I'm glad that we're able to do that. So before I turn it on to the audience Q&A, I have one last question for both of you. We talked so much about challenges and everything. Just what continues to motivate and inspire you, Dr. Sucharita?
For me, every day the motivation is the children. Every day I go to the hospital, look at their brevity, and that's what drives me to bring and maintain that smile. But above all, to be very honest, what drives me is when a parent loses a child. I don't want any other parent to lose a child. So it's always my effort that no other parent loses a child to cancer. That is what drives me every day.
Thank you. Thank you so much. What about you, Sweta?
Pat, the whole initiative of this, program, what we are doing together, is a motivation in its, in it itself. So before me joining the Max Foundation, I had never heard of any program like this. So after joining the Max Foundation, I came to know that what can be done, what changes can be done. And, I talk a lot about what the work I do. And the one thing that, keeps me motivated is when we talk to patient, even if it is, say one patient, if we can guide that one patient a day, with what they want, because they call us for whatever problems, if we are there to solve one of their problems, that is what keeps me motivated. And I don't miss any single call, because I don't know whoever is there is in need of us. So that is what keeps me motivated.
Thank you, Sweta, so much. I actually share the same inspiration. Like every day I say, if we can help one more patient, then everything is worth it. Thank you so much. All right, now I will turn it over to Laura Mapp, our Director of Development, who's going to moderate audience Q&A. So, hi, Laura.
Hi, Pat. Hi, everyone. Thanks so much. Really, thank you, Pat, and particularly thank you so much to Dr. Sucharita and Sweta for your work, your commitment to your communities. Dr. Sucharita, I was particularly struck by a quote that you had about geography becoming biology. It just really struck me and was moving. And the work that you're doing is wonderful. We've had some amazing questions already in the panel. And so now it's time to get to yours, audience. We've had one question come in. Please feel free to keep those questions coming. I'll start with one that came in earlier in the chat, and we'll try to get it to as many as we can. David had a great question for Dr. Sucharita. What are the critical tests or equipment you consider will make an immediate difference to improve cancer diagnostics for children in Nepal?
Thank you for your question. In Nepal, we are still struggling with the basic investigations or the basic equipments, which we consider the basic investigations needed to do the standard treatment in children with cancer, like the immunohistochemistry, flow cytometry. We are trying in Patan Hospital to bring everything into one roof so that once the child comes to Patan Hospital, they do not have to go to any other center. But that might not be true for other centers treating children with cancer. So they still have to send to private setups, to neighboring countries, which means there is a lot of out-of-pocket expenditures. Still in Patan Hospital, we try to use the charity funds, personal donations to include those investigations. Like, we are not talking about high-end investigations. We are talking about basic bone marrow flow cytometry, immunohistochemistry. These are the tests we require. The various molecular testings, we are still yet to do that. We are still struggling with karyotyping, fish analysis. The basic tests are still yet to be established, not only in Patan Hospital, but within the country. There have been certain initiatives to establish that, but we are still in the very initial phases.
Thank you, Dr. Sucharita. I have a question that might be best for Sweta. Sweta, how are potential patients made aware of aid that's available to them? And what outreach strategies are being used to ensure those in need know who to contact and how to access support? And I'd offer that to Dr. Sucharita as well, but maybe Sweta, do you want to start?
I think I missed your question. Until Dr. Sucharita answers, I will just have a question here, ma'am.
Yeah, I'll take that question from the pediatric point of view. Like, there are two aspects to it. Like, once the child comes suspected of cancer, comes to Patan Hospital, we have different sets of counselings. Like, we have a family support officer provided by World Child Cancer. Thanks to them, we have a family support officer dedicated to pediatric oncology patients, who takes care of not only the financial aspects of it, but all the psychosocial support too. So she provides the basic, all the financial support provided by the federal government, provincial government, all the international NGOs, and all the small NGOs which provide financial support to them. So this is taken care by the family support officer. And even during my like, I counsel them in different phases. Like, first counseling is about trying to break them the news that your child has cancer, and this. So I do not give lots of information during the first counseling, because once I say cancer, they will stop listening to anything else. So it has to be several rounds of counseling. So at that time, we'll say, yes, these financial health insurance, all these things are available, and you take, this is how you get to them. This is what happens once the child comes to our hospital. Like, and we also do, like, as I showed in my presentation, we go and train the healthcare workers in various parts of the country in partnership with World Child Cancer. The early warning sign trainings are there for the healthcare workers, where one module is where we talk about the financial and other supports available for children with cancer once they are come to the respective treatment centers. There are organizations which provide certain amount of financial support, some transportation within the city, all those accommodation support, meal support. All these various supports are provided by international and national non-governmental organizations, is also one of the modules where we talk about it. Even during the public awareness also, we always emphasize that money should not be the barrier for your treatment. Even if a child with absolutely no money comes to Patan Hospital, we never make them go back and bring the money. So we find some funds, we do something and start the treatment, because we do not want the child to a parent to go home, get the money, then start the treatment. We just try to retain them once they come to the hospital. So we don't want them to go home and come back, because there is a high chance that they will not come back to the treatment center.
Thank you, Dr. Sucharita. Sweta,
So,
did
yes.
you want to add?
So, Laura, yes. Sucharita ma'am spoke about the pediatric part of the, the funds, whereas we, as in from the Max Foundation, we have not started working in that field together. So, as I mentioned, the travel which we have been supporting with, to the patients is right now only till the breast cancer. So what happens is, at the time of verification, we ask the patient, where are you, like, from where are you coming to the institution? If they are somewhere near the institution, they only say that, okay, we don't need it. But if they are coming from a faraway place, we tell them that, okay, this is what we've been providing to you. So next time when you see your physician, you mention them that you got a call from us, and we also inform the physician about this. So the physician enrolls them in the program, So, and after that, we are in touch with the patient every time, and we make sure, because we get the data from the hospital also, we make sure that, okay, they have taken this grant from the hospital.
Thank
So
you,
it all starts
Sweta.
from the time of, it all starts from the time of verification after the physician has enrolled them.
Thank you, Sweta. Pat, I had a question for you that came in early. Outside of treating more patients, are there any more plans for expansion in Nepal? Either partnering with more hospitals? Yeah, we'd love to hear more from you there on plans for Max.
Thank you. Thank you. We always want to expand our programs. In fact, we used to work with 2 hospitals in Nepal. Last year, we were able to open a 3rd partner institution. And I think, like Dr. Sucharita mentioned, to be able to decentralize care. We do that very, very carefully, because there's a lot going. It's very easy to say you have another hospital, but all the systems need to be put in place in the other hospitals. And for example, the breast cancer program, we have yet not opened in the 3 centers. So, the goals are to have all our programs being able to be open in the 3 hospitals we're working on in Nepal. That's a big, big focus. And we have at least one new treatment for a rare hematological disease that we're going to launch this year, later this year. So, there's a lot to do, a lot of opportunities, and we're always pushing forward as much as we can, and really utilize all the resources that we can get for patients in countries like Nepal. Nepal is one of those countries that I feel there's a really great opportunity, because first of all, right now, all the medicines in our portfolio we can provide to Nepal, and this is amazing. And there are such committed healthcare providers that are our partners. And then, of course, there's Sweta and all our team that manages the program in Nepal. So I feel that there's really great opportunity to continue to help. And I'm super excited to launch especially this new program to help ease the diagnostic burden for children in Nepal.
That's great, Pat. Thank you. I probably won't be able to get to all questions, but we'll follow up with those that came in that we weren't able to get to during the call. But I did want to ask one final question of Dr. Sucharita before we close out. And Pat kind of takes us away to the end. Dr. Sucharita, I'd love to hear your final reflections, and really, after all we've discussed today, is there anything else you'd like to share about your dreams and vision for the future of oncology treatment in Nepal?
One of my dreams I always say is like universal health coverage. There is a law in some countries where the universal health coverage is the law. Even once you start to suspect the cancer till the child is treated of cancer, there is no treatment cost. Like, it not only means treatment cost. Sometimes that they're saying that treatment cost it's free treatment is not actually the free treatment if the services is not available within the hospital, and only the limited amount of services which are available within the hospital is free. But that is not what actually the free treatment is. Free treatment means everywhere from the suspicion of the cancer till the full end of treatment, there should not be cost. That is what I dream of and hope it happens one day. The universal health coverage is what I dream of every day. And we are working towards it. So hopefully it will happen one day.
Thank you, Dr. Sucharita. I hope for that too as well. Thank you. Pat, I'm going to pass it to you
Thank you.
to
Thank
close
you.
us out.
Thank you, and thank you, Dr. Sucharita, and thank you, Sweta, not only for being here today, but for all the work that you do every day. As I said at the beginning, I'm dedicating my birthday to supporting these wonderful women that you have on the screen and their work, and beyond that, the work of all the healthcare providers in Nepal. So I hope you consider supporting my campaign and making a donation today. I think Laura is putting in the chat the link. It's very easy. You can do it in 2 minutes. And if I can just tell a story for a minute, many years ago we had an art project with our patients. The theme was maximize life. We asked patients to send us art depicting how they maximize their life. And we received like 500 drawings, amazing drawings that I was so surprised, and how people shared about their dreams and their hopes and what the medicines meant to them. And there was this one drawing that was a cocoon. The pill, the medicine, was a cocoon, and from this cocoon some butterflies were coming out. And I was thinking to myself, I would never think of this. And what's this history? What's the story of this person that sent this art? So we went back to find her. She was a 36-year-old woman in El Salvador called Maria Caridad. And Maria Caridad had a very difficult life. She had 4 children, and she lived in a very small little room with 4 children. She had taken on an additional child, her nephew. She made some food and sold it in the market to support her children. And you can imagine the story. She starts getting very sick. First, she takes a long time to go to the hospital, but someday she just can't do it anymore. So she goes to the hospital. She gets told she has cancer. She gets told that she needs a medicine that's extremely expensive. And then she gets told there are these people in the other side of the world that are going to help you. And what Maria Caridad said that is very relevant to today is, she said, look, I will forever be grateful for the medicine, she said. But what really touched my heart and what really meant so much is to know that somebody cares about me. No one has ever cared what happens to me, she said. And for the first time, I don't feel alone and I feel supported. So I think when we support efforts like the one we have today of this campaign, is not just about the financial piece, is to show people that are going through the hardest time in their life that they're not alone, that we see them, that we care, that are important to us. So if you are so inclined and you can support the campaign today, I have super exciting announcement. This morning, we're announcing a matching fund for the first $4,000 of donations that come in today. So today is the day. It takes just a minute. If you are able, I would be forever grateful to you. We have raised $12,000 out of my goal of $30,000. And I know that together we can hit that goal by the end of the month. So I think the donation link is in the chat. I want to thank not only everyone in this call, but Dr. Sucharita. We admire your work. I want to dedicate my life to help you with your efforts, and I think together we can achieve your dreams. And Sweta, I'm definitely extremely grateful to you and all the work that you do. So thank you so much. Laura, am I closing this? Yes?
You
Yes.
are. Thank you.
All right. Have a wonderful day. Thank you, everyone, for your support. Thank you so much, and I'll see you soon. Bye.
Thank you, everyone. Thank you. Thank
Thank you
you.
so
Bye.
much.
Thank you.